Hey, it's Ed. Welcome to another edition of Australian Healthcare Week 2024. And we're getting closer. And so today I have a friend of mine with me who's one of the keynote speakers. So we're going to talk a little bit about that. But it's Marc. And Marc, share with us your last name so we get it exactly right.
Sure. Marc Paradis, right? You can thank the French. I'm a little bit of a mutt, one quarter English, one quarter Irish, one quarter German, but it was my father's father, so I get the full French name, Marc de l'Etoile Paradis.
Very nice. It's a beautiful name. But yeah, I'll have you introduce yourself a little bit more fully in just a second. But we're both going to be at Australian Healthcare Week and super excited to join our Australian colleagues and the whole APAC region in what's the biggest healthcare type conference in the Southern Hemisphere. So it's going to be really fun. It's March 20th and 21st, and I'll drop a link in how to register in the comment section. But we're super excited. So Marc, before we jump in, tell me a little bit about, I'm very intrigued by the artwork behind you. Tell us a little bit about it.
Sure thing. So that behind me is the School of Athens painted by Raphael. It's a fresco that's up in the Vatican, and it's probably my favorite painting of all time. This is just sort of a small piece of it from the center, but in orange over there, you've got Plato, right, pointing to the heavens, right, because his philosophy is all sort of from top down, and then next to him in the blue, you've Aristotle with his hand sort of stretched out over the earth, representing his sort of grounding and in the material world, and how these two philosophical systems both reasoned towards the same sets of conclusions, just one from first principles and the other from the world around. So it's very indicative, I think, of how we do science and how we actually deliver care in healthcare.
Yeah, I'm gonna have to look that one up. I've been to the Vatican and looked at a lot of the artwork. I'm sure I saw that fresco but I'll definitely need to refresh myself on it. But yeah, it's a beautiful. I love the whole concept of it, and
Yeah.
how we learn in different ways and different diverse, unique perspectives. So that's really cool. Yeah. So tell us a little bit about yourself.
Sure thing. So Marc Paradis, Vice President Data Strategy here at Northwell Health. Northwell Health is the largest health system in New York State, largest employer in New York State. We've got 20 some odd hospitals. I think by now we're up over 1,000 ambulatory outpatient clinics of all stripes, everything from community hospitals all the way up through specialty, tertiary, quaternary hospitals, all sorts of levels of care. So really the entirety of the healthcare ecosystem, right? At least sort of as it's practiced here in the Northeast of the U.S. But wonderful, vibrant, great place to be. My background a long time ago, different millennium. I was a cellular molecular neurobiologist doing Alzheimer's disease. Got recruited out of academia into industry, right? Doing business intelligence, data warehousing. Analytics. I had kind of this crazy idea. Can you take the best of academia and combine it with the best of industry, right? So can we take these business data sets and treat them with the same clarity of thought and rigor, right? That we treat academic data sets, but do it on business timescales, focused on building products and services that people want to buy. This was a message that fell on deaf ears until 2007, 2010, when data science becomes a thing. And that's when I realized this is kind of what I had always been. And then, just sort of over that period of time between then and now, a variety of different roles, data science, machine learning, AI. Immediately prior to this, I was at United Health Group at Optum, leading their data science university. When I got there, we had 12 students in July of 2016. And then by the time I left in December of 2019, we had over 2,200 unique employees successfully complete one or more of the programs. And it's not because we found 2,200 frustrated mathematicians and programmers, right, who just couldn't find enough C++ and linear algebra. It's because we realized no algorithm makes its way all the way out to a product or service without being touched by hundreds, if not thousands of people. And so you're really talking product management, product lifecycle, and how a data product is different from a software product, is different from a CPG product. So that was a lot of what we were doing. And then in my role here at Northwell, it's really kind of threefold. One is looking at companies and opportunities in our investment portfolio from a data science, machine learning, AI standpoint. The other is helping Northwell as a whole think through data strategy. It's not just data, but the algorithms that are derived from that data, the applications those algorithms are embedded into to drive changes in behavior that hopefully lead to improved outcomes, hopefully lead to net new value. So really the entire value chain. And then the last piece of it is building out a data lakehouse off of which we can deploy various types of generative AI solutions. So that's me in a nutshell.
No, very cool, very exciting. I love the diversity again of your background and coming from it from different angles, both academia and industry and research and then practical things. And for those who don't know, yeah, Northwell Health, I think you described Mark super well, but is one of the premier healthcare organizations in North America. I know some of your colleagues there, and your CEO in particular is a really good person doing really good things.
Absolutely.
In all the regions that you touch. So I'm always like, whenever he speaks, or I'm always listening because he's very
Absolutely.
in tune with the mission, right?
Michael Dowling
Yeah.
is amazing in his ability to inspire and to really lead and be mission driven in the best way, right? And unafraid to tackle hard problems, right? Gun violence, right? Leading cause of death in children in the U.S., right? And it's a difficult one here. I know the rest of the world maybe struggles a little bit with understanding the American relationship with guns, but it's part of who we are, but being able to go and tackle it as the health, the societal sort of healthcare public health issue that it is, while still being true to the Constitution and the Second Amendment and all the rest of that is it's a brave thing that he's doing, and it'll impact a lot of lives in a very positive way.
Totally, yeah, definitely a leading voice. So I think we kind of led right into maybe what you're going to be talking about at Australian Health Week. Can you give us like the 90-second glimpse into that talk?
Sure. Well, for me, I am all in on generative AI, right? And before you turn off the video and say, "Oh, he's just another guy who's drunk the Kool-Aid," right? Look, I've been doing this for, depending on how you want to count, anywhere between 15 and 30 years, and I've been reading science fiction for close to 45, maybe 50 years by now, right? And what I can tell you is everything that I see from a trend standpoint, everything that I see from a technology standpoint, everything that I see from a societal standpoint tells me that this is as fundamental a transition, generative AI, where I would argue this is going to be bigger than the iPhone, bigger than the internet, bigger than personal computing. This will fundamentally rewire society worldwide in the next 5 to 10 to 15 years. And so really thinking that through from a healthcare standpoint, really thinking that through from a societal standpoint, from an ethical standpoint, from a privacy standpoint, all of these other aspects. And so pretty much every talk that I give these days is all around generative AI and helping people understand these trends that I see. And even just to give a very sort of this most simplistic form of the argument for this, and this is certainly relevant to the US, and I suspect much of the rest of the world as well, there are literally not enough seats in medical schools and nursing schools to replace the doctors and nurses at the rate at which they're leaving the US healthcare system. AI is only going to go and find more people sooner who need more care. So it's a simple supply and demand thing. There already are not enough doctors and nurses and clinicians to provide the care that we need. As we increase the number of people who need care, as we increase access to care, as we address disparities and inequities in care, the only set of tools or technologies that we have to close that gap are generative AI tools and technologies. And so helping people think through that. And look, the technology is not perfect. We're not ready to go live with it today, right? We're not ready to put it into clinical practice today, but give it 3 years, and we will. 3 to 5 years, we'll be living in a very different world. It's sort of like, imagine your life in 2005 versus your life in 2010, right? Pre and post iPhone.
Yeah, it's going to be huge. I'm super excited, Mark, about attending your keynote. And again, it's at Australian Health Week, which is March 20th and 21st in Sydney. So we really encourage everyone to go. So one of the reasons I want to go is get more of that global perspective. And I think, Mark, when you were talking, it's not just a North America issue, the whole supply chain issue regarding people, human resources to do the work is impacting everyone. And so AI has the ability, not only to increase the load, but also can be helpful in taking care of people and in the future. So
absolutely, and I think especially in APAC and some other and the Middle East and Africa, where already you have this tremendous shortage of doctors relative to the populations there in so many countries. This has the potential to literally raise entire nations out of poverty, right, or alleviate the burdens that go along with unaddressed healthcare issues. This is truly transformative, not just for sort of the developed Western world, but probably even more so for all those other parts of the world.
All right. Well, Mark, you got me like super jazzed. I was going already, but for sure, I won't miss it. I can't wait to hear your talk, and especially coming from your background, your perspective that you shared. I'll leave the last word with you. Any other reason why someone should attend Australian Health Week 2024?
Yeah, it's a wonderful opportunity to really connect with a global and worldwide set of perspectives on this. And I think we have to realize, as rooted as we all are in our individual nationalities and the uniqueness of the challenges we face there, health is really a human problem, right? And addressing the health of our countries and our peoples worldwide is one of the most fundamental issues we have to being able to move forward in this world. So.
Yeah.
It's a great place to go and broaden your perspectives.
Yeah, and it's not it's a beautiful place too, a beautiful country, beautiful city. So there are a lot of different reasons to go. So I'll see you there, Mark. And
Perfect.
I'm glad. And when I talk to people like you, I'm always get jazzed, and my optimism grows. Because I know there's people that understand the tech and care about people and the mission, and that's what it's all about. So thanks, Mark, for being our guest.
Thank you.
Right.
Good talking to you.
That wraps up another episode of Why You Need to Come to Australia Healthcare Week 2024. Thank you.